Well, welcome back to more fun and games with Medical Terminology 1. And our topic for today is going to be to talk about the cardiovascular system. We want to try to get some various combining forms and a good basis of vocabulary terms for you to be able to understand things that we'll have in an upcoming video in regards to various cardiovascular conditions. So let's go ahead and get started with that. First of all, what happens is cells need energy to be able to perform, let alone survive. Activities going on in all our cells all day long, night and day, and they need energy to be able to perform various vital functions that these cells have. To be able to make energy, the cells therefore need nutrients. Okay, and the nutrients come from our environment, particularly things that we eat. They're absorbed through our gastrointestinal system, and then we use these nutrients to be able to make as fuels to be able to make energy. To be able to also burn those fuels efficiently, we need oxygen. Okay, so the body totally needs both nutrients and oxygen for the cells to be able to survive, let alone function. Okay, so we need to have some way that we could deliver these nutrients and oxygens to all the body's cells, and that's through the cardiovascular system. Now, this delivery system requires two things. Number one, it requires a pump, and the pump is the heart. The heart's a muscular pump. It's actually quite amazing organ when you actually look at it. I asked students in the past if they've ever seen a real live human heart, either one that's been dissected out or pictures of it in relationship to the rest of the body, or seen an autopsy, or been able to be fortunate enough to stand in and watch open heart surgery or something like that. And I asked them, what about the heart seem to influenced the most? And almost to a person, they'll say the heart was a lot smaller than I thought it was. And really, the heart's only about the size of your fist. Okay, so it's a lot smaller than what we actually think it is. But this pump, this very powerful small pump, works from before we're born. You know, you can actually hear a fetal heart tones, heartbeat within after 10, 12 weeks, by ultrasound. And this thing will continue to beat 60 to 100 times per minute on a normal basis for the rest of your life, for how long you live until you die. Okay, so this heart is the powerful muscular pump that's able to force this fluid, which we call blood, around to get to all the nutrients and oxygens to the cells that are needed to be able to perform. But the pump itself is not alone. We have to have some way to get it there, and that's through the blood vessels. And the blood vessels are conduits for the transportation of blood with the nutrients and the oxygen to the cells, as well as the fact that we have to realize that when the cells are doing work, they also will have waste products. There will be waste that's formed. Okay, if I take a typical nutrient, glucose, C6H12, O6, and they use this as a nutrient, as a fuel, what happens is I efficiently burn it down. I end up with H2O and CO2. H2O, water, CO2, carbon dioxide. And so what happens is carbon dioxide, oxide D, there you go. Carbon dioxide is a waste gas. We can't let that accumulate in the body. So therefore, there are wastes. Too much water, easy, eliminated through the kidneys. You urinate it out. Carbon dioxide, a waste gas. We can't, actually, carbon dioxide is actually the stimulus for breathing. Okay, not oxygen, but carbon dioxide. What happens, I can't let that carbon dioxide get levels too high, because then my breathing tendencies go down, and then you will die. So therefore, what happens, we have to get rid of this extra carbon dioxide, and we do that. We have to transport it to the lungs so it can be exhaled in our exhaled breath. But the way we do that is also by blood vessels that will be able to take the carbon dioxide and to get it to the lungs so we can exhale it and get rid of it. So not only does the cardiovascular system provide nutrients and oxygen to allow us to survive, or allow the cells to survive on a cellular basis, but it also takes the waste products that the cells are making while they're making energy and doing their normal daily activities and stuff like that, and being able to get rid of the waste so these wastes don't accumulate in the body, and the cardiovascular system allows that transportation around. Now, when we actually look at the cardiovascular system, we have two different circuits. It's actually, to be truthful with you, the cardiovascular system is one large circuit, but divided into two subdivisions. That's probably a better way to put it. Okay, so it's actually a system of two circuits that are actually put together. What starts in one place eventually ends up in the same place, give it enough time. The first circuit we have is called the pulmonary circuit. And if I look at this little diagram here, I'm going to get myself out of the corner here for a second. If I look at myself in the diagram here, this right here involves my pulmonary circuit, the things I've outlined in red. What the pulmonary circuit is, we know that it involves the lungs, because pulmonary we know means lungs, okay? And this part is for the exchange of gases between the blood and the lungs, okay? Now if I look at the blue side of this chart right here, okay, this is venous blood, and the venous blood is coming back to the right side of the heart. So this is the right side of the heart here. This would be the left side of the heart over here. It's divided down the middle, okay? The blood, when it comes back to the right side of the heart, has two things that are prominent. It has lower levels of oxygen, but high levels of nutrients, okay? The nutrients are actually picked up down here through the intestines. The stomach is his stomach and intestines here. What happens is when we eat food, the stomach helps to prepare it. And as the food that's been broken down goes to the intestines, it gets absorbed through the walls of the intestines and is put into our blood. When it's put into our blood through the intestines, it goes through what's called the portal vein. Okay, and the portal vein takes this blood to the liver with all these nutrients. And the liver uses the blood with the nutrients first. It has first shot at all that stuff, because the liver does amazing things. Nobody gives the liver much credit, but the liver does a whole heck of a lot of things which are actually really pretty cool. And then what happens is then the nutrients as well that are left go back through this hepatic vein into what's called the inferior vena cava that goes back to the right side of the heart. So basically, blood that comes back to the right side of the heart has a large amount of nutrients, which is a good thing. It's already been stocked up in that. However, when I get down to the rest of the body, the head and the legs and the arms and everywhere else in the body, a lot of that oxygen that was put in the blood has been taken out. And as a result, what happens is low oxygen, but it also has higher levels of carbon dioxide. I have to get rid of that. So the blood comes back to the right side of the heart, right in here. What's going to happen is going to have high levels of carbon dioxide, lower levels of oxygen, and high levels of nutrients. Okay? So what happens is the lungs aren't going to worry about the nutrients. The lungs really say, well, we'll wait for that. Those are for the cells. We don't need those right now. It's concerned with the carbon dioxide and the oxygen. It wants to get rid of the carbon dioxide, and it wants to increase the level. So it wants to cause a reduction in the carbon dioxide levels, and it causes an increase in the oxygen levels. So when the blood leaves the right side of the heart through what's called the pulmonary artery, it goes to the lungs. And in the lungs, it gathers oxygen and gets rid of carbon dioxide. Now we have, when it leaves over on this side over here, I have levels of increased oxygen, decreased carbon dioxide, but also still those nutrients that are there, okay? Nutrients, okay, are still there from that were absorbed down here in the intestines, okay? So that's the pulmonary circuit, and the pulmonary circuit is for the exchange of gases to get rid of the carbon dioxide and to pick up oxygen. That's what the pulmonary circuit is all about. The systemic circuit is the rest of this gobbledygook that we have down here. Okay, so if I look and eliminate that pulmonary circuit we talked about, the rest of this is all my systemic circuit. Here's the left side of the heart. When the blood leaves the left side of the heart, what happens is we have increased oxygen, decreased carbon dioxide, okay, and we have increased nutrients. I just put nuts, so you know what that is. It's not really nuts, but nutrients, okay? So therefore, now we have the optimal thing to be able, or optimal material to be able to deliver to the cells for function, okay? So it goes up, and what happens is now the blood is going to be leaving that area of the left side of the heart. It's going to go to the head and the arms. It's going to go to the lower legs and the body. It's going to go also to the liver. It's going to go to the stomach and intestines. It's going to go to the kidneys. It's going to go everywhere in the body. Actually, it even goes to the lungs. People don't recognize this, but it's true. The cells of the lungs do not get the blood that it needs for those cells to survive through the pulmonary circuit. The only reason for the pulmonary circuit is for exchanges of gas. We'll talk more about that when we talk about the respiratory pulmonary system. But basically, the cells of the lungs, the lung cell tissue does not get its blood from this pulmonary circuit. It gets it from systemic circuit, because off the large artery that leaves the heart, called the aorta, there'll be branches. It continues to branch, and a couple of those branches will actually go. They're called bronchial arteries that actually supply the cells of the lungs for those cells to live. So everything else other than the pulmonary circuit is called the systemic circuit. And eventually what happens if you start in the right side of the heart, let me just do this with a black line, okay? I'll draw this with a black line here. Once I start here, it's going to go from what's called the right atrium, which is up in here, to the right ventricle. It's going to go out the pulmonary artery. It's going to go to the lungs, where we have that exchange of gas, the thing we talked about up in here. It's going to come back with now oxygen less carbon dioxide to the left side of the heart. It's going to go from what's called the left atrium into the left ventricle. Okay, again, high oxygen, lower carbon dioxide, high level of nutrients, goes out through the aorta. It goes to the head, arms, legs, all this stuff in here. Finally, eventually, the nutrients go down. Okay, so we lose some of the nutrients that are supplied to the cells for energy. We lose some of that oxygen that's been supplied to be able to burn those fuels, and we increase the carbon dioxide as well as other solid wastes to be able to eliminate. That comes back to the heart through what's called the inferior vena cava from the bottom, the superior vena cava from the top half of the heart. We get back to the right side of the heart, and guess what? We do it again. Back again. So it's actually a complete circuit, but two sub-circuits, that pulmonary circuit and the systemic circuit within that complete circuit, with the heart being the center of it all, being that pump. Okay? Now, a couple words that I have to describe here that are going to be helpful for you, they're going to come up over and over again, are arteries, veins, and capillaries. Arteries are called efferent. Efferent means going away from something, okay? The arteries are vessels that carry blood away from the heart. Because they're going away from the heart, they're called efferent vessels. They're called efferent vessels, okay? Those are arteries. Veins are afferent vessels, and afferent means carrying it towards. So they carry blood back towards the heart. Arteries carrying blood, the efferent vessels carrying blood away from the heart. Veins, afferent, A-F-F-E-R-E-N-T, carrying blood back to the heart. Okay? But guess what? The walls of arteries and the walls of veins are thick. The arterial walls are significantly thicker than vein walls. Vein walls are actually sort of stretchy. Okay? But what happens is the walls are thick enough that these carbon dioxide, nutrients, oxygen, and other things like that can't get back and forth through the wall of the arteries and veins. They do so through what we call capillaries. Between the arteries and veins are these little small microscopic vessels that are called capillaries. And these are called exchange vessels because what happens is the walls of these small vessels are like 1 cell thick, and they have small little holes or perforations in the wall. And this is the area where oxygen can actually get out of a blood vessel at the capillary and get to the tissues and to the cells. Carbon dioxide can go from the cells into the tissue, into the blood vessels, and nutrients can then also go from inside the blood vessels into the tissues to be able to provide the cells with nutrients. And these are called capillaries. And this is where all the exchange of all the materials occurs in the capillaries, not in the arteries, not in the veins. Okay? Two other words I really want to discuss before we leave this particular slide are arterioles and venules. Arteries have a tendency to have very elastic walls. If you feel a pulse, you'll feel a boom, boom, boom. You'll feel a bounding area. And your reason why you feel that bounding is because the wall is elastic. When the heart beats, it sends a column of blood and forces it forward. And what happens, that causes that blood vessel to sort of stretch a little bit. Okay? And as it stretches a little bit, what happens is that's when you feel the pulse. Okay? So the wall is sort of very elastic. However, when I start to get smaller and smaller and smaller, these arteries all of a sudden become what we call arterioles. Arterioles. Arteriole, remember I-O-L-E means small or miniature. Arterioles are small or miniature, sort of like continuations of an artery. What happens is they change, and they change not only in size, but they change in the wall. The wall of arterioles become very muscular, which is really important when we think about it. I'm going to put my picture up so you'll be able to see what I'm talking about. What happens is because the walls of the artery are muscular, if those muscles contract, the size of the lumen or that channel gets smaller. If the walls of the muscle in the walls of the arterioles relax, the vessel will dilate, and therefore it increases the blood flow. This way, by using these arterioles, I'm able to divert the blood to areas I want it to go to and away from areas that I don't want it to go to. In other words, if there's an area that needs more blood and there's an area that needs less blood, the area that needs less blood, the arterioles will constrict, the hole gets smaller, and less blood gets delivered. The areas that need more blood, the muscles in the arteriolar wall will dilate, So therefore, now it delivers more blood to that area. And that's what happens. People, when they have blood pressure, high blood pressure, frequently what happens is that a lot of times it's because the muscular walls and the arterioles actually are hyperactive, and the walls get, the muscles will contract, and the lumen gets smaller. And as the lumen gets smaller, what we find in those situations is if I have the same amount of blood that's trying to make through a smaller hole, the pressure increases. It just makes sense, okay? You take a hose and you cut off a hose, and you squeeze the end of the hose. It comes out in a greater jet. There's greater pressure. But if you let it just trickle out, it's just going to fall out. So basically, what happens a lot of times when people have high blood pressure, some of the medications they actually give people for high blood pressure are medications that will actually relax the muscles in the arteriole walls to allow them to sort of open up, that decreases the overall pressure. They're called vasodilators, okay? So those are arterioles. So we go from an artery to an arteriole, and then the next step would be a capillary, okay? Now, once I leave the capillary, which we know are my exchange vessels, you end in what are called venules. Now, venules are small veins. They're very much like veins, but they're in a smaller, more miniature type of a format. ULE, again, that we talked about before, when we talked about suffixes, means small or miniature as well. The very beginning of these venules, just where the capillaries become venules, okay, there are still some little perforations that things could leak in and out, but not as much as we find in the capillaries. So basically what we see is if I look at the direction of blood flow from the heart, it goes from the arteries to the arterioles, from the arterioles to the capillaries, capillaries to the venules, venules to the veins, and then back to the heart, okay? So heart to the arteries, arteries to arterioles, arterioles to capillaries, capillaries to venules, venules to veins, veins back to the heart. We started all over again, okay? So that's basically what the cardiovascular system is all about. Let's get some combining forms out of the way, and most of these are pretty self-explanatory, so we don't have to spend a whole lot of time on these puppies, okay? Angio means vessel. When people get an angiogram, they take a little dye and stick it inside a vessel so they can actually see where that vessel's going to. So angio means vessel. Aorto means aorta. Now the aorta is that large artery that comes out of the left side of the heart. We'll talk about that a little bit later. If you actually look at it anatomically, it's about the size of your index finger. It's a pretty good size artery, you know, and basically it's taking a whole lot of blood that's leaving the left side of the heart to be able to distribute to the rest of the body. So that's the aorto, means aorta. Artero and arterio both mean artery. That makes sense. Arteriosclerosis, hardening of an artery, you know. So artero or arterio both mean artery. Athero means fatty. Means fatty. People have atherosclerosis, and this is this is something that people don't quite always understand. They say, well, what happens is they had a heart attack because there was so much fat that built up in the vessels, eventually clogged. You know, it doesn't make a whole lot of sense. Why? Because again, that collection of fat is slow over a period of time. They actually have a different process that results in a heart attack. Yes, the atheroma formation, or the fatty formation, is the precipitating cause, but it's not what actually causes it to happen. Let me just mention really quick what happens actually. What happens is people who have high level of blood fats, what happens is the fats then stick to the wall of the vessels, not just in the heart, but in the rest of the body and multiple other areas. What happens is as the fat sticks to the wall, various cells come and start to eat up this fat. They chomp it up. You walk, and they start to chomp up the fat. And what happens, it leaves what are called foam cells, which are basically in the wall of the vessel, which actually are abnormal. They shouldn't be there. And it causes a roughening or an irregularity, and these start to build up and build up and build up. Yes, that does change the size. If I have a lumen, which is that tube size, eventually I get fatty deposits with all these foam cells on one side and on the other side, and it gets a little bit more, and it gets a little bit more. And all of a sudden what happens is you get to a certain point when the flow that goes through that vessel becomes small enough that if someone's walking or running or doing work, they may develop chest pain, which is called angina, okay, or angina. I particularly say angina, but some people say angina. What happens, they get that simply because if the blood flow is decreased to that narrowed area, the heart muscle isn't getting its supply of oxygen and nutrients, and it says, feed me, Seymour, I'm hungry, because it doesn't get the oxygen for those cells to work, okay? But what really happens in a heart attack is when we start to build up these fatty deposits in the wall, we develop inflammation. There'll be inflammatory changes. And eventually this wall starts to crack. And when the wall starts to crack, it draws something called platelets, which are little plugs of material that actually form and start a clot. They're like they form a little, what's called a platelet plug. When somebody bleeds, the first thing that happens is platelets come there and they form a little plug. Like you stick the finger, you stick something, a cork in something to prevent it from things from coming out of a bottle. And that's what happens. What happens is the platelets come. What they do is they form a little plug because they become activated because when the lining of the vessel starts to crack open, certain chemicals are released which attracts these platelets. What the platelets then do is when they start to collect around that area, so we start to get platelets that start to collect around that area, around there, they actually draw red blood cells. The red blood cells come down, boom, boom, and they stick to the area of the platelets, and that causes a clot right there, and that's what causes a heart attack. Now, before I get any further, the actual name for a heart attack is a myocardial infarction. See that written up at the top. Or sometimes you'll see it as an MI, okay? Or they had an MI. They have a myocardial infarction. That's basically a heart attack. And that's what happens. It's actually the atheromatous plaque that starts the ball rolling, but it's actually the clot that forms because of the release of the platelets and stuff like that, like I just talked about. You don't have to remember that, but I think it's sort of interesting to talk about and mention that that's the way it occurs. Atrio means atrium. Now, atrium, I briefly alluded to it in our previous slide, was the area where the blood comes back into the heart. If you walk into a big building, you go through these big fancy front doors and you open inside, and you come into this big open area with like palm trees and, all fancy furniture, and there's usually somebody sitting at the desk saying, "May I help you, sir?" and stuff like that as you're going, or "Ma'am," as you're going in. And that's called the atrium of a building. It's a place where you enter. Well, the place where the blood enters the heart is also called the atrium. The atrium, the walls of the atrium and the heart are actually relatively thin, and they're very stretchable. They actually have a little flap which is called an auricle, but they actually will stretch a lot. There's some muscle in it, but it's much more stretchable, and that's called the atrium. Brachio we had before means arm, okay? If you feel just proximal to your elbow crease, and you should know the word proximal. If you don't, you're behind the learning curve. And on the medial side, and you should know that word as well. You feel right here, you'll feel a pulse. That's your brachial artery because that's the artery to your arm, okay? So brachio means arm. Cardi, that's an easy one. We've had so many times, which means heart. Cholesterol, do I have to even tell? Yeah, cholesterol, obviously. Corona means heart, crown, or circle. If you look at a lot of, like biblical art, you'll see a corona around a head. If you look at the sun will have around the outside. There's a corona around the sun. Okay. What happens is the heart the blood that goes through the chambers of the heart, the atrium and the lower portion, which is called the ventricles. The blood that goes through the chambers of the heart do not directly provide the nutrients, the oxygen, or the blood to the muscle of the heart. The muscle of the heart is actually supplied by a separate set of arteries, which are called the coronary arteries. So when somebody says they had a myocardial infarction, or sometimes you'll say, "Hey, they had a coronary," it meant that the coronary arteries went through this job where what happens, they end up with that clot inside there, it gets blocked off, and therefore the blood supply to a certain portion of that heart muscle decreases. Therefore the cells which don't get the nutrients and don't get the oxygen eventually will die. Okay, so we'll talk and show you what these coronary arteries are in a little bit. Some more combining forms. This is one we had before. Cyano means blue. When we have low levels of oxygen in the blood, people get cyanotic, or they get a cyanosis. They get the blue tinge around their mouth and their fingertips and stuff like that. Endo is something that we had before, means within. The inside lining of the heart, and I'll show you some pictures, some actual, cadaver or autopsy pictures in a short bit. They actually show you the inside of the heart. It's the inside lining of the heart, sort of like a milky white that lines the inside. It's a membrane that lines the inside of the heart. And a lot of times people, when they have strep throat, what happens if they don't totally treat the strep? That's why when they get strep throat, they give you 10 days worth of an antibiotic. You take it for the 10 days. If you don't take it, sometimes that strep doesn't get killed. And as a result, what happens is that strep likes the endocardium, likes that inside lining, and attaches itself to the inside lining of the heart and causes what's called an endocarditis. So the endocardium is basically means within. Inside the vessels, the endocardium will continue as an endothelium. Endothelium. So endo means within. Hemo means blood. Hematology, hematologist, okay? Hematology, the study of blood. Hematologist, one who studies the blood. Hematoma, a blood clot. Basically hemo means blood. Leuco, we know, means white. Leukocyte. Leukocytes are white blood cells. Okay, red blood cells are called erythrocytes. White blood cells are called leukocytes because leuko, we know, means white. Myo means muscle. That's where we get the myocardial infarction. Myo, muscle, cardio, heart, muscle. Infarction means death. Okay, oxo makes sense. Oxygen. When they are checking your oxygen levels, they stick that little thing on your fingers called a pulse oximeter. Oximeter, meter, instrument to measure, measure oxygen. Pericardio means pericardium, and the pericardium is actually a membrane that covers around the heart. We talked about that before. We talked about body cavities. We talked about the thoracic cavity and the ventral body cavity. Basically, that mediastinum, inside the mediastinum, there's also the pericardium, which covers about 3/4 to about 3/5 of the heart. And it's a sac that covers the outside. So it's peri means around, cardi means heart. So the pericardio means pericardium, or the sac that goes around the heart. Phlebo means vein. Some people get an inflammation of a vein, which is called phlebitis. If you go get your blood drawn, who draws it? A phlebotomist. They stick the needle in the vein and draw the blood by the phlebotomist. So phlebo means vein. Sphygmo means pulse. Now, the device that we use to measure our blood pressure is called a sphygmomanometer. But it's not really looking at pulse, but sphygmo means pulse. Stetho means chest. What do you listen to the chest with? Oh, a stethoscope. Scope, an instrument, to be able to listen or see, and stetho to chest. Okay, and that's where that comes in. A couple more combining forms here. Thrombo. Thrombo also means clot. Okay, or means clot. So when somebody has a thrombophlebitis, what happens? A clot forms in a vein because of an inflammation in that vein. Now the problem with that thrombophlebitis is sometimes it breaks off and goes, and it's called a pulmonary embolus. Have you ever heard somebody like on TV? I'm living with a PE, or I'm on a blood thinner because I've taken a PE. I've had a PE. Well, PE stands for a pulmonary embolus. This clot usually forms most commonly in the calf muscles when they're not being used. And as a result, the blood just sort of sits there, stagnates, forms a clot that causes inflammation, and this clot may break loose. When it breaks loose, it leaves the calf and it gets into the abdomen, into the inferior vena cava. That's getting bigger. Continues to go bigger and bigger and bigger, goes into the right side of the heart, still big, goes to the right atrium, big chamber, goes down through the valve into the the right ventricle, still big chamber, goes out through this another valve, the pulmonary valve, out into what's called the pulmonary artery, like we showed in that circuit there. And what happens is all of a sudden the vessels now start to change and they get smaller. Now this clot then causes a blockage to the arteries that are going to the lungs. And what do those arteries do? To supply blood, and that blood is going to have the exchange, get rid of the carbon dioxide that's been building up, and pick up the oxygen. If that doesn't happen, the oxygen levels go down, the carbon dioxide levels go up, and may be fatal. My dad died of a pulmonary embolism, okay, from a clot in his leg. Valvulo means valve. Now we'll talk about valves a couple times when we talk about some of the vocabulary terms. Valves are basically one-way flow meters. Okay, they allow flow to go in only one direction. The heart has 4 valves to try to direct that flow of blood in the correct form through the heart. Also, veins have valves. And I'll show you that a little bit later with an image as to what the veins do, particularly in the leg veins with these valves. But valves allow blood to go in one direction and not in another direction. What happens if I have a vessel right here, and let's say I have a valve right here that sits like this, if that blood flow is coming up this way, the valve will open. It opens to let the blood flow go up. So when the blood's going up, the valve opens. What happens is when the blood starts to come back down by gravity, it causes that valve to shut. And all of a sudden, those valves are really important in the legs to make a one-way flow going from the feet. Because again, taking blood to go from the feet up to the back to the heart is against gravity. That's, defies the laws of nature. But what actually happens is the muscles will squeeze, and by squeezing, it squeezes the veins, forces the blood up the column, and then when the squeezing stops, the blood tries to come down, these valves close. When those valves don't close, that's what we see called varicose veins. I'll talk about that a little bit later. Okay, vaso means a vessel or duct. Okay, vasculo also means a blood vessel. Guess veno means vein, pretty simple, and ventriculo means ventricle. Now, on the top of the heart, where the blood comes back to the heart, that's the atrium, like we talked about before. Very thin-walled, very stretchable. On the inferior portion of the heart, we have what are the large muscular chambers, and the large muscular chambers are called the ventricles. And the ventricles are the pumping chambers because they have a lot of muscle in them. They're the pumping chambers in the ventricles. Atrium, receiving chambers, ventricles, pumping chambers. A couple other words here that we should talk about, and they really don't make much sense right here. But blasto means the embryonic stage of development. Okay, we won't really talk much about that. Echo. Echo means sound. Sometimes if they want to actually look at how the heart function is, they actually take an ultrasound and stick an ultrasound transducer over the heart, and they actually see the muscles of the heart, the valves working. You can see the size of the chambers, and that's called an echocardiogram, because I use an ultrasound to be able to look at that. Megalo means enlarged, okay? And this could either be used as a combining form or it could be used as a suffix. Cardiomegaly. Cardiomegaly means enlargement of the heart. We see that with heart failure, okay? So that's what that. Let's talk about some vocabulary terms and get you in tune with that. Let's talk about this first one, the aorta. Okay. Now we mentioned this before. Okay. Now if we look at this picture right here, here's the heart sitting right here, and from the left side of the heart we have this large artery that comes out like this, and that's called the aorta. You actually see this is the aorta and its branches. Okay. The aorta comes out. I mentioned before, the aorta is about the size of your index finger. It's a pretty good sized artery, very large sized artery. Now it leaves the left side of the heart. It's sort of interesting. It has a little funny way it goes. It leaves the left side of the heart, it actually goes to the right a little bit and goes forward. And then what happens, and it goes up, goes to the right, forward, and up. And then at a certain point, it loops over the top of the heart, as you see it right here. Right here it's looping over the top heart, and that's called the aortic arch. The aortic arch. And the aortic arch has a bunch of branches off of it. This first branch is called the brachiocephalic. Second branch right here would be the left common carotid, and this third branch right here would be called the left subclavian. Okay, and so we have three arches on the top. The coronary arteries, the ones that supply the heart, actually come right where the aorta, right where the aorta starts. They come out right there. I'll show you those in another diagram a little bit later. And then what happens is then once the aortic arch arches over the top of the heart, it gets to the back side of the chest and gets stuck on the back side of the chest wall. It's actually pinned to the back side of the chest wall just next to the vertebrae. Okay, and it heads all the way down. It goes through a hole in the diaphragm, the back, and then all of a sudden it gets in the abdomen where it goes to what's called the celiac trunk. Celio means abdomen, supplies like the liver, the spleen, the stomach, the first portion of the small intestine called the duodenum, the gallbladder, the pancreas. All these organs are supplied by branches off the aorta called the celiac trunk. The superior mesenteric artery supplies the rest of the small intestine after the duodenum, supplies a good portion of the small intestine and the first half of the large intestine. The inferior mesenteric artery supplies the second half of the large intestine. The renal arteries supply the kidneys, one on each side, and the gonadal arteries supply the ovaries and the testes. Okay. Eventually, right down about here, about the level of the umbilicus, the aorta divides. One branch goes to one leg, one branch goes to the other leg. But that's the aorta. It's a large artery, a very large, very prominent artery in the body. If you want to actually see something sort of, I don't know if it's cool. It wasn't cool to him when it happened. If you look at Evel Knievel jumping the fountain at Caesar's Palace in Las Vegas, he's a motorcycle daredevil, and he was jumping this fountain. And guess what? He made it over the fountain. But the problem is, what goes up must come down. And the landing wasn't very good. And when he landed, his front wheel started to twist and turn. He did a big tumble off the top of his bike. And what happens is he tumbled, and basically he made a hole in the aorta. Luckily, they were able to save him. And that sometimes happens. You'll actually hear sometimes like John Ritter. If you guys are probably too young, but there used to be a show called Three's Company, where John Ritter lived with two ladies in this one apartment and stuff like that. And basically one day John Ritter went to work and was feeling ill. And they took him to the hospital, and a couple hours later he was dead, because what happened was the wall of the aorta up in this area right here, right where it leaves the heart going towards this aortic arch, had a weakness in it, and it actually started to separate and spread. And as a result, what happens is that eventually caused his demise a couple hours later, which is called an aortic dissecting aneurysm, which is what killed him. Okay, so that's the aorta. Arterial, let me get my scratches so you can see. And this is going to explain a number of the upcoming slides, okay? If we look at where blood's coming, it's coming in this way. The blood's coming in this way through the artery. So this would be the artery sitting right here. Let me get rid of me right there. So it says artery right there. Artery, the blood's coming in here. What happens is off the artery, there's these smaller branches, which are called the arterioles. And that's what we have right here. The arterioles, again, with those muscular walls, the walls become much more muscular, okay? And they get smaller and eventually end up in what we call those capillaries that are out here. That it's called a capillary network or a capillary bed. And there's a lot of these, okay? And this is where things go in and out. The carbon dioxide, the oxygen, nutrients and stuff like that, waste products, are able to get in and out of the vessels at the capillaries. Okay. Finally, what happens, it gets larger, we get into a venule, and finally, when the blood gets in the venule, it heads back towards the heart through a vein. So that's what we see with that. So we've described both the arteriole as well as the artery here, as well as capillaries, which are right down here, as well as venules and veins. Okay, and that's the whole schematic that we see with that. This next image right here is sort of like, it's going to take a little bit of a time for me to explain this. And I was actually tempted at some point to make another video just describing what really happens. But your heart is interesting. If you remember, what was it, Indiana Jones and the Temple of Doom, that chieftain or the chief, whatever, reaches in somebody's head, chest and pulls out the heart, and that heart is ka-boom, boom, 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 beating his hand. Well, guess what? It does that. You would think that the brain controls what the heart does, and it does to a little bit. It sort of does put a little bit of control on it, but actually the stimulus for the heart to beat occurs in the heart itself. And what happens is in the heart itself, there's this little area right here. It's called the SA node. SA stands for sinoatrial node. Sometimes it's called the SA node, or sometimes it's called the sinus node. All those things would be the same. Sinus node, SA node, sinoatrial node, they're all about the same. And what happens, these cells that are in here in this SA node are leaky. And what happens is these cells have the potential, because they are a little bit leaky and they have special characteristics, to create an electrical current. Okay, an electrical stimulus. So what really happens is this SA node starts to create 60 to 100 times a minute this electrical stimulus, and the electrical stimulus spreads from one side of the heart to the left side. This is the right side. This is in the right atrium, by the way. Spreads from the sinus atrial node across from the right atrium to the left atrium. Okay. What happens, it also goes to this little area right here. And that little area right there is called the atrioventricular node. The atrioventricular node. That's it right there where you see those two little lines. The purpose of the atrioventricular node is to actually hold up that electrical current just a little bit. Now I'm going to throw my picture back up here in the corner because I really want to demonstrate this. If I'm looking at the heart, okay, what happens is the chamber has to be filled with blood before it pumps it out. So therefore, I can't have both the atrium, which is on both sides, here's the left atrium and the right atrium, I can't have the atrium pumping at the same times as the ventricles, because then the heart would be doing this. And nothing would go anywhere. So what happens is, when that signal goes out from the SA node across the atria, it allows, and it's being held up for just a fraction of a second right here at the AV node. It allows the atria to contract first and forces the blood that's in the atria to come back through, either through here, through the inferior vena cava, superior vena cava, or through the pulmonary veins to the left side of the heart, over that side. It allows the atria to contract first to then fill the ventricles. And then what will happen is the atria will relax, the ventricles will contract, and forces the blood out. So it's going to be atria, ventricle, atria, ventricle, atria, ventricle, atria, ventricle. And that's what happens because this atrioventricular node, or sometimes called the AV node, sometimes AV node is okay, holds up that electrical current for just a little bit. Eventually what happens, it finally releases that electrical current. It goes down this little bundle right there. And the little bundle is called the atrioventricular bundle, or the bundle of His. It goes down this little bundle, and it goes through this wall that divides the atria from the ventricles. This wall is insulated. You can't get that. The only way for the electrical current, that electrical signal, to get in the ventricles is this direction, normally. There are a couple other ways it happens, which is abnormal, okay? But it's going to go through this area, through that little doorway right there. Finally, when that signal gets inside, gets into the area of the ventricles, it goes down a branch this way, which is called right bundle branch. And it goes down a branch going this way. Guess what that's called? Called the left bundle branch. And it goes down to the bottom of the heart. Now, the bottom of the heart is called the apex. And nothing really happens so far. This area, nothing really happens. But once that signal gets down, the electrical current, that electrical signal gets down to the apex, it starts to go up the walls. It goes up this way. Okay? And it goes up this way. There's little fibers are there. They're called Purkinje fibers. And these Purkinje fibers then stimulate the muscle and cause the muscle to contract. Now, this is important. Why? Because what happens is they start to contract here first, then here, then here, then here, then here, then here. Same thing happens to start, down here, then here, then here, then here, then here, and here, and here, like that, up the wall. So the contraction is up the wall here and up the wall here. Now that's really important. Why? It's really important because that blood is going to be ejected from the heart, going upwards out through here, and upwards out through here. So we're pushing it from the bottom up to force the blood from the apex up towards the heart, the top of the heart. The top of the heart is called the base. So therefore, by nothing happening here in these bundle branches, and then finally here, going up the sides, it allows the blood to be forced up, not through that one, that's wrong. Okay, let me just erase that so it's not forced, and it's going to go out this hole right here. Come out for the blood, force the blood out this way, and force the blood out this way. Out this way, it's going to go through the aorta. Out this way, it's going to go through the pulmonary arteries. So that's why what happens is we start to see it starts to contract here first, then a little bit higher, a little bit higher, a little bit higher, a little bit higher, a little bit higher. That way, it forces the blood, squeezes from the bottom up. Okay, and that's what we see with this electrical thing. I was actually thinking of putting together, like I say, a whole presentation just on the electrocardiogram in case people are really interested, not really making it a requirement, but actually somebody's interested. But this is what really happens, this happens 60 to 100 times a minute in all of us, okay? And that's how the heart contracts. And we'll talk maybe about that a little bit later, a little bit more. The atrium, okay? And the atrium are the receiving chambers. There's the right atrium, there's the left atrium. Blood's coming in through the inferior vena cava here, superior vena cava here, coming into the pulmonary vein here, and there's two more. They come in there and come in there, come in there and come in there through the pulmonary veins. And then it's coming back to the heart. It's that receiving chamber called the atrium. We've already talked about capillaries, and that capillary, here's an atrium right there. Here's an atrium right there as well, okay? We've already talked about capillaries before, so I don't really need to belabor this much more. And we know that what happens, this is just it's actually in reverse of what we had before in regards to where it's coming from. We have the blood coming down this way through the artery, goes out through an arterial, muscular wall, and gets in that capillary network or that capillary bed where exchange of nutrients, oxygen, carbon dioxide, waste, stuff like that occur in there. Finally gets collected back into the venule, and then the venule takes it back up towards the heart. And that's that. Carbon dioxide, we know carbon dioxide is what? It's a waste gas. We got to get rid of it. If you looked at the movie, Apollo 11, when you had the astronauts going to the moon and they had the explosion, they weren't worried about the oxygen. There was plenty of oxygen for them to be able to survive. What they actually worried about was the carbon dioxide. The carbon dioxide was building up inside the capsule, and they had to find a way to get rid of it. They actually did. They took a bunch of spare parts and made something to be able to get rid of the carbon dioxide. So the carbon dioxide is basically the stimulus to breathe. You ever notice when you hyperventilate, and you start to breathe fast, you're breathing really fast. When you're breathing out, what do? You breathe into a paper bag. What happens when you breathe out? What are you breathing out? You're breathing out carbon dioxide. So therefore, if you're breathing out into a paper bag, what are you breathing in? More carbon dioxide. Therefore, the carbon dioxide, then as you're exhaling, you're rebreathing, and the carbon dioxide will actually slow your breathing, because as the carbon dioxide levels go up, your breathing rate goes down. Okay, pretty cool. Okay, that's the way that works. So that's why the that paper bag trick that's why it works. Coronary arteries. Now we talked about this before. Let me get rid of these scratches so you can actually see what we're talking about the coronary arteries. Okay, we're talking about the coronary arteries. Okay, again, what we talked about, here's the aorta. Okay, and that's the large artery that leaves the left side of the heart. Takes all the blood from the left ventricle and goes to the body. That's that first branch, that brachiocephalic, which goes into a right subclavian and a right common carotid. Here's my left common carotid. Here's my left subclavian over here. Okay, you don't have to remember that right now. What happens is that's the aorta. Well, right here is this valve at the top of the left ventricle that lets blood go out the aorta this way. Well, right above the valve, there's a hole here, and there's also a hole just on the other side. And those are the holes for the coronary arteries. And those coronary arteries can come around this way. Okay, this is going to be the right coronary artery, this way. This one over here that actually goes underneath the pulmonary artery, it's called the left coronary artery. And then they send branches out. This is called the left anterior descending. The right coronary artery is a right posterior descending. So what happens is, and then there's also a branch that actually goes, this one's called the circumflex. It comes around this way, and this one is called left anterior descending that comes down this way. And this is how the heart gets its blood supply through these arteries that come off the aorta. The first branch off the aorta are the coronary arteries. Okay, and that's how the heart muscle gets its oxygen and nutrients from the area of the coronary arteries, not from the blood that goes to those chambers. Deoxygenated blood. D means without or down, descending, low. Okay, so deoxygenated blood would be blood that has low levels of oxygen, decreased oxygen levels in it. Diastole. Now this is an important word, and I'm going to throw up another word here, which is going to come up on another sheet in a second, is systole and diastole, and they are opposites to each other. I mentioned before that what happens is for something to pump out blood, it has to relax and fill. The filling time of the heart, where the heart muscle, when the ventricles relax and the ventricles are filling with blood, preparing to eject it, but they're filling with blood, that is called diastole. So diastole is a relaxation, filling time. Filling time. Systole is just the opposite. Now the ventricles are full, the ventricle will contract, squeeze the blood out, it's contracting. So systole is the contraction or ejection time, when it's ejecting the blood from the heart. Okay, that's that. If you look at someone, you take someone's blood pressure, let's take that mythical 120/80. Okay, that high number right there is called the systolic pressure. That's the pumping pressure. That's the contraction pumping pressure. Okay. This lower number right here is the diastolic pressure, or the pressure of just the blood that's filling the ventricles. Okay, and respectively when it goes on, also filling the vessels, because that's the same pressure. So the lower number would be the diastolic pressure. The higher number is the systolic pressure. Systole, the contracting, pumping, ejection. Diastole, the relaxing and filling portion, segment of the heart, or sequence of the heart. Electrocardiogram. Okay, electrocardiogram is basically I mentioned it a few minutes ago about how we get that heartbeat starts. It starts at that SA node, like I talked about just a few minutes ago. Okay, what happens is if I look at this electrocardiogram, it shows me some things. Okay, this thing right here is called a P wave. It's the letter P wave. Okay, and P wave stands for the electrical activity that's going on in the atria, that's causing the atria to contract to be able to force blood into the ventricles. And that's what I see in this P wave. If something's wrong with the atria, guess what? The electrical activity of the atria, that's going to be abnormal. This is QRS. And they look at the QRS together, QRS, and that's the ventricular electrical activity. Ventricular activity. Okay, so if the heart has a problem with the electrical activity in the ventricles, this area right here is going to be wrong. The QRS is going to be wrong. This area right here is called the T wave. Now, what happens is when electrical current goes through something, it depolarizes it. Which means it changes its charge locations. Okay? But I have to get back to normal. Getting back to normal is called repolarization. And that T wave represents repolarization. It's the ventricles getting back to normal. The ventricles getting back to normal. One other thing I'm going to show you about this electrocardiogram, okay, is when I look at this, remember I talked about how that AV node holds that electrical current for just a fraction of a second? That's reflected by this area right here. That's called the PR interval right there. And what happens is, if you ever heard like if somebody has always a first degree heart block, this PR interval gets long. There's a P wave and there's a very long break and then a QRS. Okay, that should be no longer than 0.2 seconds. This little box to here, going along this axis of the electrocardiogram is time. And that's 0.2 seconds. From this large box to here, that's 0.2 seconds, 0.2 seconds, 0.2 seconds, 0.2 seconds. This should be never longer than 0.2 seconds. If it is, it means that there's some blockage or that AV node is holding it too long. But this is electrocardiogram. If I look at the electrocardiogram, I can do lots of things. I can see where a heart attack is. I can see not just if they're having a heart attack, but where it is. I can see if the chambers are enlarged. I can see abnormal electrical activity in the heart, how the heart's functioning. Multiple things could be seen from the electrocardiogram. It's actually a pretty cool device. I used to teach a course just on electrocardiography for the PA program, and it was one of my favorite courses to teach because it was very enjoyable to be able to pick up electrocardiogram and being able to look at it and read it. Okay. It's actually pretty cool. Okay, so that's the electrocardiogram. The endocardium. Endo means within. Okay, now this is showing like the heart, showing like this is the wall of the heart. This right here would be the myocardium. So myocardium, which is basically the muscle. This right here would be the epicardium. Then this area in here, this blue area, it's not really blue, is called the endocardium. That's the inside lining. And the inside lining is covered, it's like a membranous, denser material, sort of like white and milky when you look at it. I'll show you a picture of that in just a second. And even though it has these little like squiggles in here, which are called trabeculae carni. Trabeculae are like struts. Carne means meat, like carnivorous, okay? And what happens is this area is still smooth and allows the blood to smoothly go. Nothing really is causing much of a frictional type problem to stop the blood flow. So that inside lining of the heart is called the endocardium. And if I actually look at a heart specimen, which I have right here, this area right here is the myocardium right here. It's myocardium right here. But if you look inside here is the endocardium. This is part of a valve right here. You see how it looks like it's sort of white and milky in this area? That's that inside lining of the heart, and that's called the endocardium. Again, sometimes bacteria like to rest in there if they're not taken care of, if they're killed, like strep, and that causes endocarditis. Okay. If I take that a little bit further and look at blood vessels, the inside lining, that endocardium, continues on into the blood vessels, and that's called the endothelium. So this is a blood vessel. This would be the outside of the blood vessel. This is the inside. That's the lumen right there. And this inside area right here, the wall on the inside, the area on the inside, that's the endothelium. Once a blood vessel leaves the heart, that inside endocardium continues on, and the inside of the vessel as the endothelium, Now, mitral valve. Now, I should probably talk about a couple other things that are going on here in this image right here. I mentioned before that what happens is we use valves in the heart as well as in veins to produce a one-way flow of blood. Okay, so if I look, let me just if we look at a legend, here's the right atrium, here's the right ventricle, here's the left atrium, and here's the left ventricle. What happens to our valves between the right atrium and the right ventricle? There's a valve between the left atrium and the left ventricle, and there's a valve that leaves the left ventricle to go out to the aorta, and there's a similar one which you can't see here that leaves to go out to the pulmonary artery. Okay, these are going to come up in a little bit. The valve right here that's between the right atrium and the right ventricle is called the tricuspid valve. Tricuspid valve. Tri means three. Has three leaflets. Here it shows like, almost like two leaflets, but there are actually three leaflets that are there. Has three leaflets. It's called the tricuspid valve. This one over here between the left atrium, this one right here, is called the bicuspid or the mitral valve. Most likely called mitral, but it's bicuspid because it has two leaflets as compared to three. The reason why they call it the mitral valve is because it's like the Pope's or the bishop's mitre. If you look at their hat has like two leaflets that come like this. They wear that big tall hat has two leaflets, and the hat's called a mitre. And so basically that's where they get the word mitral. It looks like the Pope or the bishop's mitre. Okay, so that's there. This little valve right here, It's right at the end of the left ventricle that's going out in the aorta. It's called the aortic valve for some strange reason. It's the aortic valve. Okay, and that's the one right above that is where those coronary arteries come out. And then you can't see it here, but from the right ventricle, it would be coming out in this area right here, underneath that area. Yeah, here's the pulmonary artery. This purple thing right there is the pulmonary artery. There's part of it goes this way, part of it goes that way. But there's going to be a little valve in there, and the one that's underneath there would be called the pulmonary valve. Pulmonary valve. So the valve between the right atrium and the right ventricle is called the tricuspid valve. The valve that goes from the right ventricle out to the pulmonary artery is called the pulmonary valve. The valve between the left atrium and the left ventricle is called the bicuspid or mitral valve. And the one that goes out into the aorta is called the aortic valve. And they're, again, all direct one-way flow. Now, why is that important? That's really important because this gives me what we call a murmur. Okay. Now, when it happens, you've probably heard the word murmur. What a murmur is if that valve is changed, or if there's when we listen to the heart, okay, and if you have a stethoscope at home, listen to the heart, and you listen to different places, it'll sound different, depends upon where you listen to it. You hear a lub dub, lub dub, lub dub, lub dub, lub dub. There's two sounds, one sound after another. The first sound, for some strange reason, is called S1, sound 1. The second sound is called S2. This S1 sound is a closure of the tricuspid and mitral bicuspid valve. This S2 is actually the blood hitting against and the closure of the aortic and the pulmonary valve. What happens if there's a problem with the blood flow, either because a valve doesn't work right or something, it creates an abnormal sound, and that abnormal sound is called a murmur when they listen with a stethoscope. So this is like this. If somebody has, let's say that mitral valve doesn't close, it creates something. It was very common thing. It's called mitral insufficiency or mitral regurgitation. It allows blood, when the left ventricle contracts to go back up into the left atrium, which is not the way it should go. It should go from the left atrium to the left ventricle, and it doesn't go that way. As a result, when you take the stethoscope and you listen over that area of the mitral valve, you hear a like it's a very blowing sound, okay? And that shows me that valve's not closing. Sometimes if I listen over the area where the aortic valve is, which is higher in the chest up in here, if the aortic valve is narrowed, or what's called aortic stenosis, you hear something different. You go, which is basically because if the valve is closed, or the opening is much smaller. When the blood gets ejected from the left ventricle, it goes to a smaller hole. It's like a jet, and that jet creates that sound. We'll have holes in the heart that will show abnormal sounds. But when you hear these abnormal sounds, it's called a murmur. It's called a murmur. The myocardium. The myocardium, okay, is basically the muscular portion. If I look at this, this is an artist's rendition of the heart. Here would be the endocardium in here, okay? Here would be the epicardium out here, and this all in here is the myocardium. Myo means what? Muscle. That's the muscular portion of the heart. When people have a myocardial infarction, the muscle dies and gets replaced with scar. So that's what happens with that. So that's called the myocardium. That's the myocardium. So look here at this diagram right in here. Okay, what we're actually able to see, here's the inside. So you see that the endocardium right there, that filmy looking layer. This is also part of the endocardium right there. See how it looks sort of filmy? But if you look at this beefy area right here, that's the myocardium. That's the heart muscle right there. Also, you see some heart muscle right here. You see some heart muscle right there. Okay, but that filmy, shiny area that's in here is the endocardium. Here's part of the valves. Okay, and here is part of the valve that's right there. But this area in here is the myocardium, or the muscular portion of the heart, the part that requires for contraction and injecting blood. Normal sinus rhythm. Okay, now this is electrocardiogram. Okay, now where does the heartbeat originate from? The sinus node. Ooh, sinoatrial node, SA node, sinus. Okay, so I'm seeing something with sinus showing up. If what happens in a normal sinus rhythm, I mentioned before on electrocardiogram, the P wave shows me what happens in the atrium, and that's where the right atrium is where this heartbeat originates from. So what in this normal sinus rhythm, I look at the P wave here, 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 and they're all the same distance apart. And if I looked at the rate, it's between 60 to 100 beats per minute. So the P waves look normal. If there's something wrong with the P wave, it might be high or peak. Sometimes I've seen a double hump P wave for different reasons and stuff like that. But what happens in this case, the P waves all look normal. That's a normal looking P wave. 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 They're all the same distance apart, and they're all between, and the rates between 60 to 100. That's what we call normal sinus rhythm. It means the heart's starting in the right place and the heart's working the way it's supposed to be. Few more vocabulary terms. Oxygen. Oxygen we talked about, we know is a respiratory gas. Oxygen makes burning fuels more efficient. If you have a fire and you want that fire to blaze hotter, what do? You add oxygen. You put oxygen in there and boom. If you ever go by a hospital room or you go by those big tanker trucks, it says oxygen in there. Keep away from flame. Why? Because it'll blow up. So as a result, oxygen helps to improve the efficiency of making fuels. We get much more energy when we use fuel with a certain level of with oxygen in the presence of oxygen as compared to without oxygen. Sinoatrial node, we talked about that before, and that's that sinus node that we talked about before. This the place where it all starts. That's where the magic begins. It's also sometimes called the pacemaker of the heart. When people have a sick sinus node and the sinus node isn't working, they sometimes have a device that we put in that actually has an electrical current or electrical wire that goes to the area around that sinus node. Goes to this area right around here. It's implanted. They actually screw it in to the wall of the area of the right atrium. That actually, from a little box with a little charger, a little battery, sends out that signal to start things moving. Okay, but normally that's not needed. I actually have a defibrillator in my chest because I had a heart attack when I had a myocardial infarction when I was 36, and my heart has some great strange things going on with it. So if my heart rate goes bad, this little defibrillator gives me a shock, over my back, boom, and my arms go flying and stuff like that. But on the other hand, what happens, my defibrillator also has a lead that goes to this area right here. So if I ever need a pacemaker, they can actually put it in. Or if my heart is going too slow, it'll say, okay, give them a little zap, and it gives me a little zap which I don't feel to the area of the SI node to tell my SI node get working. Okay. Pericardium, I really don't have to talk too much about the pericardium. We've talked about that a lot. And this is just looking at the pericardium. And basically that pericardium is that sac that surrounds the heart. Here what happens is, you can see this is the back side of the heart, okay? But here you can actually see it better. Here you actually see, let me get my mug out of the way. You can actually see that this is that sac that's been opened up. Okay, in a diagram here, they open up and now you see the heart through in there. And that sac has a little bit of fluid. So the pericardium is a little bit of what's called pericardial fluid. And that allows the heart to move without restriction. Okay, it allows it to slide inside the chest so it's not stuck to anything. So that's the pericardium, or that sac that surrounds the heart. And again, this is looking at it. And if I get rid of the scratch right here, you can see it better. So this is the heart. You really can't see the muscle and stuff like that, but you do see this area right here. There's a little area cut off. So you're actually able to see inside that pericardial sac if you look down inside there. Okay, and that's that sac that surrounds the heart called the pericardium. The pulmonary artery. Okay, the pulmonary artery is the artery that leaves from the right side of the heart. Now this actually shows all four valves. Okay, and I'll show you those again. This right here would be my tricuspid valve, right, going in here. Okay, this right here is the mitral valve. Okay, here's that aortic valve that sits right here, and here's that pulmonary valve like I talked about. Well, that pulmonary valve, when the blood comes into the right atrium, it goes to the right to the tricuspid valve into the right ventricle. It goes out to the pulmonary artery. It goes out to the pulmonary artery to that pulmonary valve. And this is the pulmonary artery. When it gets up, it goes underneath the aorta. Here's the aorta as it branches over the top. The pulmonary artery branches this way and branches this way. This one goes to the right lung. This one over here goes to the left lung over that way, and that's the pulmonary artery. Okay, so that's what that is. And again, here are those three arteries that come off the aortic arch. There's the brachiocephalic, the left common carotid, and the left subclavian. Okay? We don't have to talk about this anymore. I think we talked about it ad nauseum earlier on. And this is that pulmonary circulation. The pulmonary circulation, we know, is the circulation that goes from the right side of the heart, to the lungs, the left side of the heart. And that's to get rid of the oxygen and to pick up the carbon, or to get rid of the carbon dioxide and to pick up the oxygen. And that's that pulmonary circulation. Pulmonary valve, again, here's that pulmonary valve like we showed in the previous image right there. Here's the right atrium. Here's the right atrium. Here's the right ventricle. And Once the blood comes from the right atrium to the tricuspid valve into the right ventricle, it goes out to the pulmonary arteries or pulmonary, again looping underneath the aortic arch, and that would be the area of the pulmonary valve. Okay, pulmonary veins are a little bit different. Pulmonary veins are bringing the blood that now has gotten rid of the carbon dioxide and picked up the oxygen and is bringing it back to the heart. Now, these come actually in the back side of the heart, more so than anything else. You can see the pulmonary veins coming in right here from the left lung, and pulmonary veins that come in, and they'll actually come into the left atrium over here underneath there, and it's coming in from the right lung. So the pulmonary veins are bringing the blood back from the lungs to the heart now with increased oxygen and decreased carbon dioxide. Okay, pulse. Pulse is again that expansion of the artery that we feel. We could find pulses all over the place. This one's here. It's called the radial pulse. Or you can find the brachial pulse. You actually feel it sometimes up in your armpit or the axillary region for the axillary pulse. You could feel in your neck for the carotid. You could feel on the top of the foot for the dorsalis pedis pulse. You could feel at the top of the leg, right where the crease is in the top of the leg, for the femoral pulse. And these are just pulses, and they just reflect the forward flow of blood being injected by the heart. Okay, a couple more words here. Septum. Septum is just a word that means wall. It means wall. So if you see septum, it means wall. And this is just a model. Here's that wall. Here's the right ventricle. Here's the left ventricle, and that wall between is called the septum. Some people have a deviated septum. And it means that the wall between the right side of the nose and the left side of the nose is divided, and that's called the septum. So septum just means wall. Sphygmomanometer. Sphygmomanometer is basically that device that we use to take a blood pressure. Okay, and there's all kinds of different things. This is the older type. You very rarely will see this at this point. Most of them are digital and all kinds of stuff. And then, so sphygmomanometer is basically a device that will measure my blood pressure. The systolic pressure, which is my pumping pressure, and my diastolic pressure or relaxation pump pressure, which is the filling pressure. Okay, systemic circulation. Again, that's when it leaves the left side of the heart. So down here. Actually, this is actually a pretty cool diagram. When it leaves the left side of the heart and goes to the rest of the body, that's called the systemic circulation. It leaves the left side of the heart, goes to the heart, goes to the heart, the coronaries, the lungs, the bronchial arteries, okay, to supply the tissues, not where the air is exchanged or the gas is exchanged, but to the actual cells of the lungs. Goes to the head, to the arms, to the abdomen, to the legs, everywhere, and that's the systemic circulation. Okay, systole we talked about before. Okay, and this shows you the picture, the differences between systole and diastole. If you look here, this part on the left is ventricular diastole. So what you see is the ventricles are filling up. The blood's going from the atrium into the ventricles. Blood's going from the atrium into the ventricles, and the ventricles are filling. The ventricles are relaxed. They're not contracted, but they're filling up. That's diastole. Systole over here on this side, what we're seeing is the ventricles are contracting and they're forcing blood out either through the pulmonary artery or out through the aorta. So that's the difference between the two. Tricuspid valve we've talked about before, so we don't really need to spend much more time on the tricuspid valve. And basically, if we're looking at the heart here, this is the right atrium. This is the right atrium right here. Here's the left atrium right here. This is coming in from the superior vena cava, coming in from the inferior vena cava, and what happens, the blood comes back and it goes through this area down into the right ventricle through that three-leaflet valve called the tricuspid valve. This one over here is the bicuspid valve. Here's the aortic valve. You can't see the pulmonary valve here, and this one right here. And a valve, we know, is something that will direct the blood flow. When I want blood to go through, the valve's open. When I don't want blood to go through, the valve's closed. Now these valves right here are called semilunar valves. Semi-lunar. Lunar means moon, but they're not really, and semi means half, but these are actually in thirds. There's actually three leaflets, one leaflet, two leaflets, three leaflets, 1, 2, 3. And this is the pulmonary and the aortic valve, the way that they look. When blood leaves the ventricles, these valves will be open. When the ventricle stops contracting, the blood doesn't want to go back from the vessels, from the pulmonary artery or the aorta back into the ventricles, these valves will close. And that's the valve. We also see valves in the leg, and this is what we were talking about before. That what happens is we get the blood in the legs have to get back up to the heart. It's going against gravity. So we need to have some blood flow that's going to actually force blood this way. When the calf muscles and the leg muscles contract, it actually squeezes these vessels and forces the blood up. But what happens is when the muscle contraction stops and the blood by gravity wants to come down, it closes the valves. So it prevents the blood from going down. So the problem is sometimes that doesn't work. Certain things like pregnancy, inflammation, and stuff like that, inactivity causes these valves to stop working, and they stay open and allows a two-way flow. And what that does is that results in something that looks something like this. These are typical varicose veins that people get, and the varicose veins are simply because what happens is those valves don't work. And now blood is going upwards, but it's also venous blood is also going downwards. Okay, and that's what happens with that. Vein, we know veins, and this is just a venous diagram showing where the veins are coming from, and basically largely it shows me up in here it's coming from back from the superior vena cava, from the head and the arms. Here's the inferior vena cava, everything that's draining. The kidneys are draining into the inferior vena cava, the liver is draining into the inferior vena cava, a lot of things are draining into the inferior vena cava. Here's the legs on this side, and they're draining back and they're going back into the right side of the heart. So those are veins. Veins are vessels that take blood back to the heart. Okay, let's see what we have here. Here's the vena cava right here. Here's the vena cava coming into the right side of the heart. Now this actually also shows the ventricles, and the ventricles again are the lower chambers or the pumping chambers. Okay, so basically if I'm looking at this, here's a ventricle here, here's a ventricle here. Here's the left ventricle on this side, here's the right ventricle on that side. Venules, again, you've seen the diagram that's like this before. Here's my artery coming down this way. Arteries branch off into arterioles. Arterioles develop into a capillary network or capillary bed where we provide the nutrients and oxygen to all the tissue cells, okay, and take all the waste products and put them back in the blood. Gets collected into a venule at the end of the capillary bed. It goes back up to the heart through a vein, okay, and then so we have that's a. So what we've talked about here is we've given you a whole lot of words in regards to vocabulary terms which are really critical in the cardiovascular system. Okay, hopefully you'll go over these maybe a couple times either through your PowerPoints or through this video again and review those, because what happens is the next video we're going to talk about some conditions and other specific aspects of the cardiovascular system which are really pretty cool, pretty exciting, and to be able to understand and to follow it, it's probably a good idea to know these words down pretty well. So these are common words that you'll see a lot in the cardiovascular system. Most of these words are used in the hospitals day in, day out. Okay, so these are very common words. So hopefully you've learned something from this. If you haven't so far, go back and look at it again and learn it, because guess what? It's going to show up on a quiz. So anyway, we'll talk to you later. In the meantime, be safe, be healthy, and the next time we'll talk about some cardiovascular conditions.